Good Tuesday evening, and thank you so much for joining us for WDVM News at 6. It's a brand new month of the year, and now 2 years in today, the United States passed the grimmest milestone yet with more than 75 million confirmed cases of the coronavirus since January 20th of 2020.
Yeah, that's right. And that's just the confirmed number of cases. The number of Americans who have died from the coronavirus is even worse. More than 890,000 people have lost their battle with COVID-19. The hardest hit U.S. states are still California, Texas, Florida, and New York. And Virginia has reported more than 1.6 million cases, while Maryland sits at least 500,000 coronavirus cases. And speaking of Maryland, with a high number of COVID cases, healthcare workers have taken the brunt of the force of this pandemic. Hospitals in Maryland are facing critically low numbers for these necessary staff members.
Yeah, and joining us live from the control room is our Katie Reed. Katie, you actually spoke to the Maryland Hospital Association today. What did they tell you? Is there anything that the state or federal government can do that will help?
Well, Alexis, just yesterday, Governor Larry Hogan announced that the COVID positivity rate in the state has dropped below 10%, and that hospitalizations for COVID have dropped more than 50% in just a few weeks. But that really doesn't equate to a break for those healthcare workers. Now, as the CEO of the Maryland Hospital Association told me, those vacant beds from recovered COVID patients are often almost immediately filled with another patient needing care. Now, the Maryland Hospital Association says that hospitals across the state have over 3,900 nursing vacancies, and that's a 50% jump from the last poll taken in August of 2021, when hospitals collectively reported just 2,600 nursing vacancies. Now, MHA says that Governor Hogan's 30-day state of emergency order has helped to alleviate some of those stresses, and this is by allowing for flexibilities in staffing, like bringing in qualified staff from out of state and allowing nursing students to assist in hospitals. But MHA says it's not enough, especially with COVID numbers still rising, but there is a piece of legislation that could help.
We have pending in the legislature the Healthcare Heroes Act, which would give our health secretary certain powers administratively to expand the healthcare workforce flexibility without the governor having to declare a public health emergency, which has been our only lever to pull.
Now, that 30-day state of emergency will expire this coming Friday, but the Maryland Hospital Association is hoping that the order will be renewed or that the Healthcare Heroes Act that we just heard about will pass through the legislature. For now, reporting live for WDVM 25, I'm Katie Ray.
Yeah, Katie, quick question for you. What happens if this state of emergency ends and the Healthcare Heroes Act has not yet passed?
Well, guys, so in the past, when the state of emergency ended back in August, and this is when Governor Hogan stopped renewing those orders last summer, he did grant a grace period of around 45 days for those staffing flexibilities to continue. But it really is up in the air right now, and MHA is hoping that if the Healthcare Heroes Act doesn't reach the legislature soon, then another grace period will be granted.
Katie, thank you so much for breaking that down for us. So the Maryland Hospital Association also hopes that Governor Hogan will address the impacts that the pandemic has had on our healthcare workers during his State of the State address that will be taking place tomorrow night.